So RaDaR is a data repository for consenting patients across the UK with rare diseases. We've now got 102 different hospitals that are recruiting patients and around 25,000 people with around 30 categories of rare diseases, rather more individual rare diseases. And the number of patients ranges from over 6,000 people with polycystic kidney disease to around 1,000 people with other disorders like Alport syndrome and membranoproliferative glomerulonephritis, and very small numbers of people with sort of ultra-rare diseases. When patients sign up to RaDaR, the reason for signing up is to participate in research, and the implication, and as stated in the consent form, they are waiting to be contacted for research studies, whether those are academic research or interventional research. That's what patients are expecting. They understand that having a rare disease puts them at a disadvantage because they need to make contact with or they might want to make contact with other people suffering from the same disorders, that they can form networks for stimulating research, and of course providing a cohort that's big enough to answer a research question is a really powerful thing, and the overwhelming enthusiasm from patients is what struck me ever since I first got involved in RaDaR. The second purpose is it allows us to collect information about patients. The RaDaR registry includes automated data feeds of hospital laboratory data and also clinical data from patients who've all given their consent for this data to be collected. And that's all collected together at the Renal Registry, and then in what we call pseudo-anonymised form, which is with the patient identifiers removed, researchers can then look at what the, for instance, progression of renal disease illustrated by the changes in serum creatinine in individual patients with a particular disease has been over time. And we can also look at use of renal replacement therapy, because all patients are registered with the renal registry once they start on dialysis or receive a kidney transplant. So we've got a growing retrospective and prospective collection of certain clinical information which spreads right across the country. In addition to that, we have data feeds that are inputted manually or collected separately, where the RaDaR registry forms as the sort of case record form, if you like, for clinical studies that are either ongoing or that are planned in the future. And researchers can, with a research question, can access that data and answer specific questions about what the effect of a disease is on patients, or what the effect of an intervention is on patients, or correlate things like genetic data with clinical data across large groups of patients with rare diseases. Among other things, we're using the power of the NHS, the same healthcare service provider that's across the country, to enrol patients from a large geographical area and a large population, so 60 million people live in the country, and they all have a relatively standardised care in terms of delivery of renal replacement therapy and also delivery of treatments and monitoring for renal disease.